disease includes a variety of diseases from the heart or the blood vessels. Plaque builds up in the arteries due to a number of factors. Blood flow is restricted to a smaller area. Arteries become clogged and or blood clots form. And then heart attack or strokes may occur. So heart attacks and strokes, if you aren't familiar, are actually very similar mechanisms. It's just the location, right? So if we're cutting off blood flow to the heart, we're going to have a heart attack. If we're cutting off blood flow to the brain, we're going to have a stroke, right? So both of these things, if you have someone in your family who has had a stroke or you have someone in your family who has had a heart attack, they're both like very interrelated. So sometimes we think of just heart attacks or just heart disease, and we don't think of that stroke piece of the puzzle. And it's really important to note, if you do have a stroke history in your family, that your heart health is just as important as someone with a heart disease, typical heart disease in their family too. Okay. So a heart healthy tip: regular exercise helps improve blood flow to prevent plaque buildup. So exercise helps keep that heart pumping, keep the blood flowing, and prevent that plaque from building up. So what are the four most common forms of heart disease? We have coronary artery disease. You may see it abbreviated as CAD. This is damage or disease in the heart's major blood vessels due to the buildup of plaque in the arteries. We have a heart attack, which is when oxygen is temporarily cut off to the heart. This is generally due to the buildup of plaque over time in the arteries. We have stroke. So when a blood supply is cut off and damage to the brain occurs. High blood pressure is a leading cause of stroke. And then we have CHF, or congestive heart failure, a condition in which the heart doesn't pump blood as well as it should. The most common reason for heart failure is coronary artery disease, which is the first form that we talked about, that CAD. So you can kind of see how all of these things are interrelated, right? We started with talking about CAD and how we have a buildup of plaque. And then when we talked about heart attack, we talked about how buildup of plaque can cause a heart attack. We talk about CHF and how that can also be affected by CAD, right? And then stroke, as I said in our previous slide, is very interrelated in the same mechanism as a heart attack. So you can see how these all are related and all can impact each other and increase our risk. So the link between diet and heart disease, of course, we know there's a genetic component, but there's a very big diet-related component to heart disease as well. So one of the best and most researched methods to help our heart health through diet is actually a diet called the Mediterranean diet. And that's really because it's based on what the diet would be like of the people of the Mediterranean. So that Greek culture, that ocean side of the Italian culture, that high seafood diet, high vegetable diet. And we'll go into ways that we can incorporate some of those principles into your diet. So we have the Mediterranean diet. So what we're going to eat the most of, so our high intake foods are going to be olive oil, nuts, fruit, vegetables, whole grains, legumes, herbs, spices, and fish, right? Think of like that coastal culture, right? We have our moderate intake foods, which are eggs, cheese, yogurt, and poultry. Those are kind of our middle ground, not too much, not too little, kind of in the middle. And then we have our low intake foods. So red meat, processed meats, refined grains, sweets, highly processed foods. So with sweets and highly processed foods, we have an increase in added sugar, which studies have shown increases our risk for heart disease. So making sure we're reducing those added sugars as much as possible. In our red meat, also with that saturated fat, we'll go into more. That's going to increase our risk for heart disease as well. So making sure that we're monitoring our saturated fat intake, same thing with processed meats. So our heart healthy tip: choose olive oil as a heart healthy alternative to saturated fats in cooking, right? The best visual that my patients really seem to love is picturing your fat that you're eating in your arteries, the same consistency it is at room temperature, right? So our olive oil, it's going to be liquid at room temperature. It's very fluid, very easy to move through those arteries. Your butter is going to be hard. It's going to be stagnant. It's going to be sticky, right? It's going to help build that plaque, which is something we don't want. Now, everything can be included in moderation, but it does help you, like, without having to read every single nutrition facts label ever. What does this fat look like in my blood? It's a very nice visual and easy to be like, oh, okay, this is more unsaturated. So this is something I can include more frequently in my diet because it's more liquid at room temperature versus something that's more solid is going to be solid in your arteries, right? So healthy fats, do they exist? So we have trans fats. There are artificial fats that provide no nutritional value, raise LDL cholesterol. LDLs are bad cholesterol, and increase the risk of heart attack, stroke, and diabetes. So it's found in baked goods, fried foods, frozen pizza, ultra processed foods. I will say there has been a tremendous and beneficial shift to not using trans fats in these products. It's been, I would say, over the past 10 years, there's really been a pushback saying like these are not healthy, they're not good for our communities, they're not good for our population's health. And a lot of grocers, specifically like Walmart, which if Walmart does something, then everyone follows suit, are pushing back with including trans fats in food. So thankfully, we have seen a decrease in trans fat in our diet. Now I will say that you will still see trans fats that naturally occur mainly in animal products, right? So if you still look at butter, you may see a gram or two of trans fats, and those are different than the ones that are lab created. They still naturally occur, but at a much lower rate, and they actually behave differently in our bodies than the lab created trans fats. So being mindful of that. So if you're looking at something and it's pure animal product, right? And you see a trans fat, that's a little bit different than, say, looking at a bag of potato chips and seeing trans fats in them. So I'm keeping that in mind. Then we have our saturated fats. So these are animal fats that are high in protein, but raises LDL cholesterol. It should be consumed in moderation and opt for low or non-fat options. So these are those solid at room temperature fats, right? Still have a place in our diet, right? But all things in moderation. We want to tend more towards those liquid at room temperature fats, okay? Then we have our unsaturated fats. So healthy fats that are lower in LDL cholesterol and raise HDL cholesterol. HDL cholesterol is actually protective to the heart. So if you ever get your labs done, we want that HDL cholesterol to be greater than 40, right? That's the one cholesterol level that we're wanting to be high, right? We want to lower our risk of heart disease with higher HDL. So if you have, one thing that I ask my patients when they come to see me is, yes, I want that total cholesterol number, but I'm also interested in what amount of your cholesterol is LDL, what amount of your cholesterol is VLDL or non-LDL cholesterol, and what amount of your cholesterol is HDL, right? Because someone who has a level that's, let's say, 110, let's just use 110, but their LDL is 60 and their HDL is 50. That's very different than someone whose HDL is 20 or 30 and then their LDL is 80, right? I'm using easier numbers to grasp than we might actually see in lab work, but it's a very different story. So looking at what those components of cholesterol are within your labs makes a big difference in that whole picture of your health. So then we have our heart healthy tip: swap trans fats with unsaturated fats for heart health. Now we have finding sneaky added sugars. I already alluded to that a little bit. So consuming too much added sugar puts you at risk for high cholesterol, diabetes, and high blood pressure. You want to limit your intake of added sugars to 6 teaspoons per day, or about 24 grams. So where we can find added sugar, we can find them in condiments and sauces, baked goods and sweets, applesauce, flavored yogurt, milk, sweet beverages like soda, energy drink, frappuccinos, sweet lattes, alcoholic beverages, especially mixed drinks, are going to be very high in added sugar. So what they're doing is they're adding calories, right? We're adding energy, but we're not adding that nutrition, right? So if we think of something that is typically high in sugar, like a fruit, right? That is also on top of the sugar that is naturally found in fruit. We're getting fiber, we're getting vitamins, we're getting minerals. There are a lot of other benefits to fruit, and sugar's not bad, right? Sugar gives us energy. We need sugar. Our body lives on sugar, right? But there are different types of sources. So when we use those added sugars, which are really just that pure sugar, cane sugar, and there are different sources. I'm using cane sugar as an example. We're not having those other benefits, right? We're not having that fiber. We're not having those vitamins, those minerals. It's purely adding energy and calories. So by adding foods more in a whole food sense, we're getting more of a well-balanced amount of energy paired with all of those other benefits to those foods. I'm gonna answer this question right now. So stevia, is it an okay substitute for sugar to sweeten coffee, or is it artificial or bad? So I will say dietitians may have different views. According to the research that I look at and I've seen come out, unless you are eating literal pounds of artificial sweetener every day, I think it is a great tool to use in your toolbox to reduce your calorie intake, depending on your goals, right? Decrease your calorie intake, increase your satiety. It may be based on your personality. I have people who are like, I need to use an artificial sweetener in my water, so I drink water, right? Like to me, that's so beneficial to your health. And just the studies aren't there to show that it's detrimental to our health to use. So unless you're someone who, again, is literally eating pounds of artificial sweetener every day, then maybe some studies might apply to you. But I would be surprised if we have anyone on this webinar today who is doing that. So I am of the mindset that an artificial sweetener is a great tool to have in your toolbox. And again, coming back to all things in moderation. So our heart healthy tip, read food labels to identify and reduce hidden or added sugars in your diet. Scaling back on sodium. So a diet high in sodium increases your risk for kidney disease, stroke, high blood pressure, and heart failure. The American Heart Association recommends no more than 2,300 milligrams of sodium per day. Foods high in sodium are processed meats, condiments, seasoning blends, savory snacks like chips, pretzels, crackers, snack mixes, packaged foods like frozen meals, pre-made rice, canned soup. So think of what do we need to do to preserve a product, right? And that's going to be those foods that are higher in salt. So frozen foods, it's really important to read the label on frozen foods because there are some foods like your flash frozen vegetables, those steamer bags of vegetables, which I think are an amazing tool for busy families to have vegetables always at hand and ready to go. Those aren't packaged with salt, right? They're flash frozen. But then we have our packaged meals and our packaged frozen pizzas, right? Like they're going to be higher in salt because they're more prepared foods and they're just packaged a different way. So read your labels on your frozen foods. And also with your canned vegetables, there are a lot more options for lower sodium foods. In canned varieties, those can be another great tool in your toolbox to use. As far as where was I going to go? Label reading, that's what I wanted to touch on. For label reading, always read the label. Sodium is notorious. I bet so many of us today have a story of reading something where they looked at the normal variety and then there's the low sodium variety. It is notorious for not being that different, right? So soy sauce is one that if you look at a regular soy sauce, it's extremely high in sodium, right? If you are looking to lower your sodium intake, please really try and pare down your soy sauce intake if you're someone who enjoys it, right? It's 900 milligrams for a serving, right, of sodium. If I look at the low sodium variety of soy sauce, it's still 650 milligrams of sodium, which we would still consider a high sodium food, right? But on the packaging, it says it's low sodium, right? But it's not. So please pay attention to your labels when you're looking for low sodium varieties, and you can decide, if it's something that you're going to save. Let's say the original is 400 milligrams and the low sodium is 350, but sometimes low sodium costs more. That might be a choice where you're like, I'm just going to get the regular. I'm mindful of the fact that it has a little bit more sodium than the low sodium variety, but I'm going to save that dollar to go towards maybe some extra veggies this week or extra fruit, right? So using that knowledge to reduce your sodium intake either through moderation, or you can use those low sodium products if they make sense, right? Be a critical consumer. All right, so a heart healthy tip. Use herbs and spices to season your food instead of salt to reduce your sodium intake. So using those spices and looking at herb blends before you do use those, because sometimes they do have salt in them as well. But those can be a great tool to use to reduce your salt intake, but increase that flavor profile. Fueling up on fiber. So fiber lowers LDL cholesterol, controls blood sugar, keeps you full, aids weight loss, improves digestion, lowers risk of heart attack, stroke, and diabetes. So fiber is really cool in that it lowers our cholesterol. It actually binds it up in our intestine and lets it pass through our bodies. So it's a great thing to have in your diet. And it goes back to what I was saying about eating sugars as in from it whole fruits instead of from added sugars, right? So how do we get more fiber in your diet? Eat the skins of fruits and veggies, switch to whole grains, and add beans and legumes to your diet. So whole grains, again, back to labels. Make sure you're reading the label. Anything that says enriched or enriched white flour. Sometimes you might see a label that says made with whole grains. That is something that they can use to have part of, maybe some of the flour they used was whole grain, but not all of it. So looking at your ingredients on your nutrition label, you want to get a 100% whole grain product. Our heart healthy tip, ease into higher fiber intake by incorporating one fiber-rich food per meal, gradually increasing your portions for digestive comfort. So if you're someone who hasn't really been focusing on the increasing your fiber intake, take it slow, right? Because if you go from, our goal is like 25 to 35 grams of fiber per day. But if you're someone who's averaging, say, 10 grams per day and you go to 25 or 35, you're probably going to get some stomach upset and probably some bathroom troubles, right? So go slowly, add one thing at a time, get that in your routine, add something else. Maybe I am going through my white bread, right? But I ran out of spaghetti for this week, so I'm going to get whole grain spaghetti this week. And then whenever I run out of bread, then I'm going to get whole grain bread. No need to throw anything out. You can gradually shift over. Okay, our top heart health tips. So prioritize sleep as it contributes to overall heart health and well-being. Sleep is so often overlooked as for the important role that it plays in our health. Getting that 7.5 hours every night. Our bodies aren't just turning off during sleep, it's actually helping these other processes continue. So different processes go on in our body than when we're awake and when we're asleep. So getting adequate sleep is so beneficial to our health and healing our bodies overnight. So tip 1 is eat a balanced plate. So I'm sure you guys have seen a variation of this plate, right? Whether you've seen my plate or you've seen it as healthy plate, you've probably seen different variations of this, and this is no different. So we're going to have a quarter of our plate be lean protein. We want to stick to lean proteins like fish, skinless chicken, or pork tenderloin to limit your intake of saturated fats. Fish like salmon and cod are high in omega-3 fatty acids that can help reduce the risk of heart disease. So fish oil is really well studied in the heart disease realm, and including fish and fish oil in our diets, whether you're increasing, I would suggest both actually. Now, depending on your situation, best to talk to your healthcare team and your dietitian. But in my population that I've worked with, I see a benefit for both, increasing your fish intake, but also maybe leaning on a fish supplement. If you are someone who wants to take a fish oil supplement, I highly recommend taking it at night. I see a lot less side effects of those, like that fishy feeling in your chest for people that take it at night. But it's just really well researched to improve our heart health. Another quarter of our plate is going to be those whole grains and starches. We have fiber-rich foods can help reduce total cholesterol and balance blood sugar. We already talked about that with your fiber, right? Boost your fiber intake with foods like sweet potatoes, wild rice, beans, lentils, quinoa, oats, right? Whole vegetables, whole fruits. The more skin, less peeling of the things that you do, the more fiber you're going to include in your diet. And there are different types of fiber, right? We have soluble and insoluble fiber. So that skin of the fruit is going to have different fiber than the interior, say, meat of that fruit. So it's great to include both. Non-starchy vegetables. Antioxidants help lower blood pressure, cholesterol, and inflammation. and decrease your risk for heart disease. Green leafy vegetables and fruits like broccoli, spinach, tomatoes, kale, bok choy, and berries are loaded with antioxidants. Antioxidants are just a different way to word vitamins, right? Vitamins play a key role in the antioxidation process in our body. So making sure that we have a good balance of vegetables in our diet, and in a variety, right? So a raw vegetable or a cooked vegetable, the cooking process sometimes can actually improve nutrition of that vegetable. For instance, cooking in a cast iron skillet increases the iron content of our foods. So doing a variety of different things, not eating the same thing over and over. We call it eating the rainbow, right? So maybe one day I'm going to have, or make sure I include a red vegetable and an orange vegetable. Next day I'm going to do a yellow and a green, right? Getting all those different colors, those mean different nutrients and balancing of our diets. Then, of course, on our plate, we want to include healthy fats. Monounsaturated fats help reduce bad or LDL cholesterol and prevent heart disease. Get your fill of healthy fats by cooking with olive oil or adding avocado, nuts, and seeds or yogurt to your meal. So with healthy, I recommend taking one of these sections, right? So maybe one night it's going to be, I want for my non-starchy vegetables, my oil as maybe a marinade another night. So maybe I'll do a steamed vegetable that night and I'll add it to my protein for that dinner, right? So you just pick a category, and maybe I want to have a baked sweet potato and I want to add some oil to my sweet potato and I want to bake it in the oven. Maybe that's for my starch, I'm doing my oil. So pick a category and add your oil to that. And that kind of helps you balance including that healthy oil, but not going overboard. So one category per meal is kind of the quick tip that I like to use. So for our heart healthy tip, prioritize sleep. Yes, of course, always prioritize sleep. I could talk about sleep all day long. Can you tell I'm a mom of 2 kids that sleep is such a priority to me? Tip 2, get regular movement that you enjoy. Sometimes we forget that last piece. There are so many different varieties of exercise out there. We want you to be happy and be excited to move your body, right? We want to move because it feels good, not because I have to, right? So heart healthy exercise, cardiovascular exercise, elevate that heart rate for endurance. Aim for 150 minutes of moderate intensity aerobic exercise per week. So if we divide that 150 minutes, we're looking at, if you're doing 5 days a week, so let's say every weekday, we want to get 30 minutes. And that can be broken up into 10-minute chunks. We know for heart health, as long as we're doing at least 10 minutes, and if we're doing, say, 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening, we still see heart preserving benefits, okay? So it doesn't have to be 30 minutes all in one go. As long as you can hit that 10-minute mark, you are going to see heart saving benefits. We have strength training, which builds muscle strength, supporting our heart function. So include muscle strengthening activities on 2 or more days, targeting major muscle groups. And then one piece that I find people often forget about is that flexibility training. So enhance flexibility and circulation, right? Circulation, obviously, we're talking about heart health. And also flexibility is at such a core of maintaining health and balance and our safety, right? So as we're doing those other exercises, making sure that you're flexible, it decreases your risk for injury, and then it increases your ability to keep that exercise going, right? Because if we get injured, then we're setting back. I can't get that 150 minutes because I need to take the week off because I tweaked my knee or I tweaked my abs or whatever. So we want to make sure we're including all of these different categories to make sure that we're balancing our whole body. Consistency is key. Establish a regular exercise routine for long-term heart health. And if you're someone who doesn't include exercise right now, just getting in the habit. So think of those 10-minute chunks. If you're like, man, I can do that. I can do that 10 minutes 3 times a day. So when I wake up, I'm going to do 10 minutes. Maybe during my lunch break or after work, I do 10 minutes, and I'm going to do 10 minutes before I go to bed. If you feel like, I don't even know if I can raise my heart rate right now, get into the habit of making that time. So maybe right now it's meditation. Maybe you're focusing on flexibility right now and you're like, I just don't feel comfortable getting my heart rate elevated. Get that habit going and slowly add that activity in. Because the more you can say like, this is my time and I'm going to use it, then it becomes habit. And then as you feel more comfortable, then you can add in more activity. Get in that habit and like like this slide says, it's a long-term goal. It's not, I want you to do this for 2 months and do the best you can and like feel like you're going to fall over every single day of your life, right? This is a lifelong commitment to yourself, to your body. So I want it to be doable and attainable. And that's where working with your dietitian, we can help set those goals that are appropriate for you, right? Sometimes we do set goals where it's just, let's just stretch for 10 minutes and get that habit in check. Maybe we are going to walk for 10 minutes and it's all personalized. There's no right or wrong. Consult a fitness professional, seek guidance for a personalized plan. For a heart healthy tip, choose enjoyable activities for sustainable, consistent, long-term heart health benefits. So again, consistent. We don't want you to white knuckle it. We want you to be able to say, you know what, that wasn't so bad. I'll do it again tomorrow. Tip number 3, be the driver of your health. So making sure that you're aware that you're in control, right? Take control, educate yourself, learn about heart healthy choices, portion control, and nutrient balance. So what you're doing today, what you're doing when you work with your dietitian, learn about what you need to be doing to fuel your body so you can be in control of your health. Set goals, collaborate with your dietitian to establish achievable dietary goals. Monitor progress. So every time you come back with your dietitian, we're going to be asking you, like, how'd you do this week? Did you get your 150 minutes? How did you do with your fiber intake? Track those habits and celebrate small victories. Sometimes I work with patients and maybe there's someone like with the exercise, they started out as stretching as their exercise goal. And now we're saying, hey, look at this. Like now you're running for 10 minutes 3 times a day and your fiber intake now is at that 35 grams, and we can look back and see where you've come from, and it's really encouraging to see that whole picture change. Effective communication, openly communicate with your healthcare team. So if you're concerned about something, or if something doesn't make sense to you, maybe you get your labs back and you're like, you know what, this lab came back weird, but I don't really know what it means. Don't be afraid to reach out to your healthcare team. They're there to support you. They're there to make you feel comfortable and to understand your health, because if we don't understand it, then we can't make those changes, right? So make sure you're communicating with your team when something isn't clear. Other empowering strategies, regular exercise, like we talked about before, that 150 minutes of exercise weekly. Stress management, so practice mindfulness, deep breathing, other stress reducing techniques, right? We sometimes take for granted the ability just to calm our bodies and recenter. Medication adherence, follow your prescribed medications and attend regular medical checkups. So diet is such an important part. Exercise is such an important part, but for some people, medication may also be such an important part. It's important to see all those pieces of the puzzle together. That medication may be something that is lifelong for you. It may be something that you need right now, but it's such an important piece if it is something that's necessary to make sure that you're able to make those dietary and exercise changes. Because if you have high blood pressure, let's say, and you're not taking your high blood pressure medication, and then you're adding in exercise, we're elevating that blood pressure even higher, it would be unsafe, right? So making sure if you're someone who needs to take blood pressure medication, you take it, you can increase your exercise. Maybe as you increase your exercise, your blood pressure becomes more regulated, and then you can come off that blood pressure medication. So making sure we do things in the right order and understand that, again, our team is there to support you and do what's best for you. Our heart healthy tip, actively manage your cardiovascular health through collaboration with your healthcare team, focusing on diet, exercise, stress management, and medication adherence. You drive your health journey, making sure you always feel in control. And if you have a team that's not supportive of you, get a provider that is supportive of you and can help you feel like you are in control. So meet with a dietitian. Of course, I'm going to say that that's so important. Being a dietitian myself, I know the role that we play and the changes that we can make in our patients' lives. So when you work with a Food Smart dietitian, you get an accountability partner. So someone to go through those goals with you. One, to make sure you're meeting them, and then also push you a little bit further. So whenever those goals become a little easier, okay, well, what can we do next, right? We have a support system. We're there for you. We're there to listen. Sometimes my sessions feel more like therapy sessions than a dietitian appointment, but that's completely fine. That's what we're there for. Diet is so complex, right? It's so simple, but yet so complex. So it depends on the week. We're there to support you. We're there to coach you and help you out. We're unbiased. We have an expert source of information. We're there for you. You know, we know sometimes weeks are hard and sometimes those goals don't get met, and that's completely okay. That's what being human is all about, right? But coming to that session every week and being accountable and saying, you know what, I didn't meet that goal, but I want to meet it next week. So what can we do? What can I learn this week so that next week I rock it? I do awesome. And that's what we're there for. So we want to get started today for as low as $0, depending on your health plan, plus a chance to win that $250 prize. Again, that code Heart Health for www.foodsmart.com/schedule. So let's look at some recipes. And these are all from the FoodSmart website. If you are interested in any of them, you can search. They're named exactly like they are in the website. So you can always go back and look at these, but these are like some really great options. So we didn't talk a lot about eggs, but eggs are a really great source of protein, healthy fats. And then in this recipe, we're going to pair it with veggies. So we're going to increase that fiber. So that's a really great source of fiber for your diet. So let's talk about this. So it's going to be a combination of hash browns, spices, veggies, topped with eggs, right? It's quick. It's a wholesome dish, ideal for breakfast, brunch, complemented by warm pita. So recommended to have some pita on top of it. Of course, I love pita bread. And then pairing with a cucumber salad, you can really boost that fiber, increase that vegetable intake. Oops, I'm gonna go too far. There we go. Lunch, we're gonna do some Brussels sprouts and a quinoa salad. And this is actually a vegetarian dish. So something that's really great with a vegetarian dish is we are naturally decreasing that saturated fat intake, right? We're more so leaning towards those unsaturated fat. It's high in antioxidants. So with that increase in vegetables, we're increasing our vitamin C intake and antioxidants, and low in sodium, right? So that's such an important part of heart health, is decreasing that sodium intake. And it just I mean, quinoa is just so good. I love it so much. I could eat it every single day. Going too far. Dinner. So this one is another vegetarian dish, which I like to have like a meatless Monday, right? Vegetarian protein options are really great to balance out that health, and it is part of the Mediterranean diet. So increasing your plant-based protein intake is a great way to increase your heart health as well. So this is a sweet potato and black bean chili. So it's with whole foods, packed with nutrients, fiber, antioxidants. It's high fiber, again, so it supports digestion, weight management, and cholesterol. It's actually rich in potassium. So this is great for blood pressure regulation. So potassium is an important part of blood pressure regulation. And plus, like this time of year, that just like this recipe just feels so like warm and toasty, and I just want to curl up on my couch and eat it. Okay. So what have we learned today? So heart disease encompasses many different heart conditions, but they kind of all go together, right? Limit foods high in saturated fats, sodium, and added sugars. Focus your meals around foods high in fiber and unsaturated fats, right? So fiber helps lower that cholesterol. Unsaturated fats are protective for our heart health. Eat a balanced diet full of healthy fats, complex carbs, and lean protein. Complex carbs are going to be more of those whole grains versus like simple carbs would be more so like those added sugars. Get regular movement of 150 minutes per week by doing something you enjoy. Again, it could be biking, it could be walking, it could be running, whatever makes you happy. Stay on top of your heart health with regular visits with your dietitian. Find a new plant-forward recipe to start your heart health journey. So leaning on some more of those plant-based proteins can be really productive to your health. So set realistic goals for adopting heart healthy habits one step at a time, right? So working with your dietitian to set those goals that are realistic for you, and again, can be continued through the life cycle, can be continually improved upon. It doesn't have to be tomorrow I'm going to run a marathon, right? It can be tomorrow I'm going to walk to my mailbox, right? Tomorrow I'm going to walk for 15 minutes around my block. It's completely personal to you. So we do have a Heart Smart nutrition program at Food Smart, which is 12 weeks focused solely on heart health. So it's one-on-one support with your dietitian. You work through a comprehensive program guide for offline learning. So you actually get a packet that you get to look at all the lessons and look at all of the principles that we talk about. We get access to the Food Smart app for recipes. So all 3 of those recipes that I mentioned, plus thousands more, you'll have access to in the Food Smart app for meal planning and grocery ordering. So with those recipes, you can actually go and click on them, and you can even pick serving sizes, which is super nice for families. You can pick how many serving sizes you want, and then it'll pull over into the Walmart app, because that's where I shop, but it'll pull over into the Walmart app, and you can order your groceries from there, and it already has the complete list of ingredients from that recipe. And you can unclick, like say it's a spice that I already have in my cabinet that I need, then I can unclick it and I don't have to order it from Walmart. So it's really helpful. All right, so now we're going to open up for questions. And I want to just re-emphasize one more time, using that Heart Health code to get entered to win that $250 prize of your choosing and get a $15 gift card if it's your first visit. So again, Heart Health, www.foodsmart.com/schedule. So Lindsay, the chat box was like so active today.
It was. First of
I
all,
love it. You guys are
yeah,
awesome.
yeah, awesome job, Alyssa. There was so much information in there. I think you kind of sold the idea of needing a dietitian because of how technical some of these conversations can be when you're talking about lab work and things like cholesterol and blood pressure and ranges and optimal ranges. And there are a lot of questions around that. So, Alyssa, I sent you a note. I sort of pulled some questions out of the chat if you want to take a look through there. And while you were looking, I can take one quickly that I did a little research on while you were talking
Sure.
about Girl Scout cookies, which are, it is the season of Girl Scout cookies. So, pretty
Very fun.
interesting. So someone had asked, they'd done some quick calculations and said on the back of their Girl Scout cookie box, it said that the saturated fat content was 5 grams and the recommended size was 4 cookies. So they were like, does that mean that the kind of recommendation for saturated fat in a day is at roughly 20 grams? So I just want to kind of address that quickly. And someone was like, don't take away my Girl Scout cookies. We're not going to take away your Girl Scout. So quickly, the daily recommended intake of saturated fat is 10% of your total calories, right? So if you're eating a 2,000 calorie per day diet, that's going to be around 200 calories, and fat is roughly 9 calories per gram. So you're going to look at about a 22 grams, sorry, per day of saturated fat. So those are the daily recommended intakes at a national level, and that's what's going to inform your nutrition labels. That's a totally fine range to stick to. However, I do want to call out, because it is American Heart Month, and certain associations that are focused on conditions like American Heart Association actually recommends a little bit less than that. So DRI is 10%, and that's kind of general population, but American Heart Association recommends 5 to 6% of your calories from saturated fat. So that's going to be a difference of about 22 grams per day. And then the Heart Association is saying roughly around 13 grams per day. So that's kind of a range you could look at depending on the level of focus you have personally on heart health, or if you have certain conditions. And again, tying it back to the dietitian, that is something that your dietitian can work with you on, finding what that specific range looks like for you. So
Perfect. Thank you.
yeah.
Okay, so looking at, let's see. Okay, so coconut oil was one of the ones that you sent me. Is coconut oil healthy? It seems to be a fad. So coconut oil, I will go with all things in moderation, right? I am very hesitant. I don't like, and I would say probably most dietitians don't like the word like superfood or anything that is being marketed as like the end all be all of all things. Um, Coconut oil is a very highly saturated fat. It's what we call a tropical oil. So I would say use it in moderation. And coming back to if you're using coconut oil over olive oil, then I would say no, like you shouldn't be doing that. You should be using more of a unsaturated fat. But that's not to say that you shouldn't be using it. right? But I would just be hesitant to be using it in the quantities that some people feel like, oh, it's coconut oil. I can use it for everything. And it's still a fat, it's still a saturated fat. So just being aware of that.
Yeah, and a quick check to know whether something is saturated or unsaturated is whether it's solid or liquid at room temperature. So coconut oil, if you stick it in your pantry, unless you live in a climate that's 80 degrees, it's going to stay pretty solid in that jar. Same thing with like butter. Those are both saturated fats. It has to do with the structure of the fat itself. And unsaturated is going to be liquid at room temperature. So your olive oils, your other oils.
Right. So next question was, what is the difference between LDL and VLDL, and which one should we be more concerned about? So LDL and VLDL, they're acronyms, as I'm sure we can all assume. LDL stands for low density lipoprotein. VLDL stands for very low density lipoprotein. So LDL is what we usually consider bad cholesterol. That's the one that we want to lower. VLDL actually is protective to our heart, as is HDL. So that's why I talked about earlier with the lab work, knowing the composition of what type of lipoprotein is high in your blood work, because the LDL is the one, those are big, right? So we're looking at big cholesterol molecules. VLDLs are going to be very small. So they can obviously move much easier through your blood vessels. So whenever we talk about the cholesterols that we want to reduce, we're typically talking about that LDL cholesterol. Let's see. Oh, are there any things that can cause artificially high cholesterol? So the example was like if we eat a lot of pizza the night before the lab draw. So we have standards, like whenever you get lab work done, they'll tell you, we want you to fast for X amount of hours, right? So as long as you're following that, test results are generally correct in your baseline. Alcohol can affect your cholesterol levels, so it's recommended to abstain from alcohol for at least 24 hours before your cholesterol blood work, because it changes our function, right? It changes your liver function, and it can change your lab values. So that's one thing that can change the numbers. That's important to keep in mind. But overall, as far as diet goes, as long as you're following the fasting regulation, the recommendation, then you should have a pretty standard awareness of what your lab results say. Of course, genetics also play a role, but yeah, if we're talking about diet, as long as you're sticking to that like 12-hour fasting rule, then you should be good. Oh gosh, how long does it take for cholesterol to lead to heart disease? I don't really know the answer to that question. And I would say it's, for some people, that genetic factor really plays a big role, and it can cause a lot more of a detrimental effect over someone who maybe has no genetic implications in their DNA for heart disease. And I hate to say this, but it seems to be like the luck of the draw, right? So that's why we have people who can present as healthy, but can have some detrimental effects rather quickly, versus someone who has maybe a really unhealthy diet and the genetics are just in their favor, and they don't have any of those effects. Lindsay, do you have like a different take on that?
No, I mean that's a really tough one, and it is just so highly individual. I think,
Mhm.
as you said, for some people it can be a really slow burn. And so, you may see high cholesterol around your early 30s, and you may be able to, not see any detrimental effects beyond that for 10 plus years, but then you may not. So
Mhm.
it's really like, it's very tough to answer. And it also depends on what else is going on and maybe what's driving that high cholesterol. If it is related to alcohol, specifically, that can do some different things. So yeah, I mean, as you said, it's something, that's why we monitor it. And it's generally recommended to take action to sort of lower it regardless, because we don't really know what that
Mhm.
might.
Exactly. Yeah. Thank you. Yeah. Um, Next question was about triglycerides. Like, what if those are high, and how does that compare to cholesterol? So triglycerides, if we're looking at the
You broke up there a little bit, Alyssa. I don't know if that's the case for everybody else.
Can you guys hear me now?
Yes, you're back.
Perfect. All right. So triglycerides, they're actually the fat molecules in your blood versus the lipoproteins that the cholesterol is in your blood. So high triglycerides mean there are actually high fat molecules in your blood, a high amount. And what we mean by high is anything over 150. And that increases your risk for heart disease. So it's a bit of a different indicator because we're talking about actual fat molecules versus cholesterol, but they're all interrelated. So we don't want those triglyceride numbers to be high because that shows that our body is holding on to and has a higher volume of those fat molecules, which increase our risk for heart disease.
Mhm.
Okay. If I only have high blood pressure, what should I focus on to lower it? So if you're generally healthy and your lab work's coming back, you don't have high cholesterol, what should you do? Sodium's going to be the biggest one, and exercise. So exercise is going to be so important because it's going to strengthen your heart muscles. It's going to strengthen, it's giving, it's not just exercise for your muscles, right? It's exercise for your heart. It's exercise for your arteries. It's exercise for your veins. It's exercise for your whole circulatory system. So it's going to strengthen your body. And then with that, if you have, say, if you're not an average weight, I'll say, not an average weight, and we increase exercise and we focus on reducing sodium, we might decrease processed foods, we might increase our veggie intake and our fruit intake. So therefore, we might have a weight shift, or I will say a body composition shift. And that can also benefit your blood pressure as well. So if I'm simplifying it, I would say decrease sodium and increase exercise.
Hmm. There was a question about sodium specifically. Someone said that they took a quiz and it listed that their max sodium should be 1,500 milligrams per day. And they were asking if it should be that or should it be 2,300. How would you think about that?
Well, again, it's working with your dietitian, seeing if you have any other factors, right? So kidney disease plays a role, whether or not your what your size is, right? So like I'm 5'2", I'm gonna have a very different ability to process sodium versus someone who's much taller than me, right? So it's going to depend on your body composition, which is why working with a dietitian to figure out that individual level. I would say 1,500 is generally the recommendation for like active heart disease, active renal disease, when we're really paying attention closely to that sodium intake. So if you're someone who's like, you know what, my blood pressure is like creeping up there, like that is not an out of realm possibility for an appropriate recommendation as far as sodium goes. But for the general population, we go up to that 2,300.
Mhm.
Um, let's see, what time is it? Oh,
5
good.
minutes.
Still have 5 minutes. Awesome.
Any
What are
other?
some ways? What were you gonna say?
I was gonna say any other questions, get them in now.
Yeah. What are some of the best ways to get cardio in that are low impact? I have sensitive joints and knees. What about someone with costocarditis, very painful chest wall inflammation, walking? You just lift it. Okay. So if you are someone who, regardless of the diagnosis, whether it's arthritis, whether it's, a past injury that just on a rainy day bothers you, right? Swimming is a really great option that's low impact. And the Y is a very common place to be able to, that's accessible to a lot of people to get water aerobics in. Some people, depending on your diagnosis, you may also be able to do it through PT. So swimming, I mean, right now, I wish, we're not very much in the swim mode at this time of year, but an indoor location would be a great option, right? Um, let's see, yoga, you mentioned yoga is a great option as well. If you feel like you can handle Pilates, depending on the level, right? So finding a really great yoga and Pilates teacher and instructor that does various levels, those can be low impact and help and not be more of that like bouncing, jumping, big, you mentioned lung capacity and chest pain, right? So if we're doing low, slow, meditative almost exercise, that can still be beneficial.
Yeah. And for the person who asked specifically about costochondritis, which I have actually had, it's inflammation in your chest wall. I had it post-COVID. It can be very painful. There are some great yoga videos, things you can find online that stretch that out. And then generally I would say like low and slow. So low intensity cardiovascular exercise, aka walking instead of running, that still gives you that aerobic fitness, but it's not going to have you heaving and sort of aggravating that inflammation. So that's what I would say there.
Exactly. So let's see. 3 more minutes. Okay, what is the role of fiber in heart health exactly? How do I know if I'm getting enough? So fiber, what it does is it actually binds cholesterol in the intestine and removes it from the body. So it lowers our cholesterol in that sense. And it also can help support VLDL, cholesterol in our body. So lowering LDL, supporting VLDL. How do I know if I'm getting enough? So I mentioned the recommendation is 25 to 35 grams. Again, can be individualized. It depends on what your current rate is, right? So working with your dietitian, if you're averaging about 10, we're not going to say we want you at 35 next week. But getting in that 25 to 35 gram. Now you can have too much fiber, which can cause like constipation issues. But that would be a very small subset of the population. Most commonly, I'm seeing people who aren't eating enough. So just like you would for anything else, if you're curious, you can look at labels and do some, label reading maybe for 3 days. What do I eat on average for breakfast, for lunch, for dinner? And kind of get a baseline of what you think you're eating, or working with your dietitian, they can help you find a baseline from what their experience is and what their expert knowledge is on fiber intake. And then you can go from there. So maybe by next week, I would like to increase it by 5 or 10 grams and then keep going towards that 25 to 35 gram range.
Yep. And there's actually a really great question that might be a good one to end on in here.
Okay.
Latoya asked if it is possible to reverse heart disease or damage by implementing some of the items that we have mentioned today.
Yeah, so actually, yes. The short answer is yes. So we can support heart health, and I always like to say there's never too late. It's never too late to work on your heart health and your heart journey. So you can be post heart attack, you can be post stroke, right? You can have CHF and still be working towards heart health, and we can see improvements in those labs. I have patients who, their heart function was dwindling and now it's coming back, right? So it is never too late to make progress on your health. And again, working with your team to find what's appropriate for you. So again, if you're a severe CHF patient, like those recommendations are going to be very different than someone who's generally healthy and is worried about an elevated blood pressure, right? But it is never too late, and you can always make progress towards your health, and it's always important.
Absolutely.
Yeah, it's a really good question. That was like
A good
uh,
pin.
yeah, I know. It makes me so hopeful, right?
Yeah, it
That-
is. It really is. I know it
Yeah.
can feel very disheartening, and when you get lab work back and you're like, you feel like you're putting in a lot of effort and you're trying, and I think it can just sometimes come down to like very small tweaks that again a dietitian can help you pinpoint, and so that all of your effort is directed in the right place. And so yes, as Alyssa said, it is never too late. So yeah, we just encourage you all with that. So
Yeah.
thank you all so much.
Thank you so much for coming.
And thanks, Alyssa, for the awesome presentation. All right. Thank you, guys.